Okay, welcome everyone. Thank you all so much for joining us today for our Behavioral Health Consultant Certificate Course Information Session. My name is Sujina Perajuli. I'm the Program Manager for our Integrated Healthcare Initiative Program at Mental Health America of Greater Houston. Before we dive in, I want to give you some background, a little background of our organization. At Mental Health America, our mission is to empower the community through mental health education, advocacy, and connection to care. And we envision a future where mental health is prioritized and every person lives a life of dignity, resilience, and hope. Our purpose, the purpose of my program, which is called the Integrated Healthcare Initiative, is to create partnership, provide leadership and vision, advocate and educate, and provide technical assistance needed to integrate and implement and sustain integrated care. And our vision is the care that is accessible, cost-effective, and it's the standard delivery of care for all. So before we dive into the details of the program, I want to give you a quick overview of integrated behavioral health, as all of our programs are focused on that. So the integrated behavioral health is the care that results from a practice team of primary care and behavioral health clinicians who are working together with patients and families using a systematic and cost-effective approach to provide patient-centered care to a defined population. So team care, they address mental health, substance use, and behaviors that affect physical health, which are then identified during the clinical primary care visits. Sorry, I'm admitting other people as they're joining. So in integrated behavioral health, there are two widely used models, and one of them is called the primary care behavioral health model, also known as PCBH. PCBH aims to improve the primary care team's ability to manage and treat behavioral health, mental health, and physical health conditions that are common in primary care setting, such as depression, anxiety, pain, substance use, obesity. These are all quite common in primary care setting. So in this model, the clinic focuses on a broader patient population to improve the health and wellness of the entire clinic population. So they provide evidence-based treatments and utilize brief interventions that are used in primary care setting to address these acute behavioral health conditions of the patient. This model, it has a behavioral health consultant who is considered a core member of the primary care team. So they can be either an LPC, LMFT, licensed psychologist, or an LCSW. They operate with a primary care team from the same clinic, same location, same workspace, and share equal responsibility for providing care to their patients. And the role of the behavioral health consultant can actually be summed with one acronym called GATHER. So for GATHER, the G stands for being a generalist because they are assisting patients of any age with any kind of biopsychosocial issues. A stands for being accessible. This is where they strive to intervene with all patients on the day that they are referred to them. T stands for team-based care. So this is where they share a clinic space, resources, and assist the team in various ways. H stands for high volume, which means they engage with a large percentage of clinic's population. E stands for education, where they help improve the team's biopsychosocial assessment and intervention skills and their processes. Because remember, at the clinic, behavioral consultants are not only there as a mental health experts. And so it's their obligation to help the team increase their knowledge in this area of care. And then lastly, R stands for routine. They are a routine part of the biopsychosocial care in primary care clinic. So with that, let's segue into our into the Behavioral Health Consultant Certificate course, also known as the BHC course. So we are the first in the state of Texas to provide a certification program for behavioral health consultants in favor of integrated behavioral health framework. So this program is designed to improve the gaps in providing and receiving behavioral health consultation services in primary care. Through this course, we strive to train behavioral health consultants in becoming competent in addressing health disparities, improving health equity, and promoting health in vulnerable and historically excluded populations. So the objective of our program are as followed. We hope that our students will be able to identify the components of the integral role of behavioral health consultant within the PCBH model. Discuss, identify, and apply interventions to improve teamwork and performance. Describe the effect of health equity and health disparities on health outcomes. Identify and utilize interventions and strategies to facilitate behavior change. And lastly, evaluate best treatment plan based on efficacy and expert guidance. So here are some details that's going to be important for you to know as you make your decision to apply for the course. So we're in partnership with Rice University, who is primarily in charge of hosting this course on their education platform called Canvas. So this cohort is going to be completely virtual. It's going to be a self-paced 8 months long course. There are 4 mandatory meetings, and attendance for all students are required for these 4 meetings. The first meeting is called the boot camp. This is typically the launch of the course and the first day, and is considered the first day of class. Then we offer 2 live learning sessions, again, hosted virtually, where students will be able to test their skills using standardized patients, also paid actors. The students will be able to practice warm handoffs from the primary care provider. They will have 15-20 minutes to conduct brief interventions. At the same time, we will have our faculty and their peers listening in and providing constructive feedback as to how the student can improve their role as a behavioral health consultant. And finally, we also offer a PCBH refresher training in between the course. So apart from these mandatory 4 meetings, we also provide bi-monthly virtual office hours, and they're going to be led by our faculty members for additional support and assistance to our students. We do offer partial discounts based on availability and funding. It'll be provided on a first come, first basis. We will be providing discount in 75, 50, or 25% increment, depending on the applicant's eligibility, and I will discuss those in a few slides. So this course will also, so through this course, our students will also be able to earn 40 CME credits upon completion of the course. And the most important eligibility requirement for this course is this. So these are our 4 disciplines that we're targeting through our program. Eligible students, they must be either a licensed social worker, a licensed professional counselors, licensed marriage and family therapist, or licensed psychologist, and they must be currently working in a primary care setting. So these are the most important and main requirement for all eligible applicants. Even though the application is open to all, priority will be given to Texas applicants first, and our seats are limited to 36 students for this upcoming cohort. Now let's talk a little bit about our faculty member. This is our lead faculty, Dr. Stacy Ogbide. She's nationally known as for her expertise in primary care behavioral health, and this program would not exist without her expertise. She is a licensed psychologist, assistant dean for faculty at Long School of Medicine, UT Health San Antonio, and she's a primary care behavioral health educator and a board certified clinical health psychologist. And then these are our supporting faculty who will teach the course alongside Dr. Ogbide. Our faculty onboarding was based on the recommendation from Dr. Ogbide. Some of these individuals were her students 2-3 years ago, and some of them now work with her at UT Health San Antonio. So quick background of each of the faculty members here. So first we have Dr. Gabriela Gibson Lopez. She is a licensed psychologist and an assistant professor of family and community medicine. Then we have Dr. Yahaira. She is a licensed clinical psychologist and an assistant professor who works as a behavioral health consultant to primary care populations and educates and trains psychology residents. Then we have Dr. Ebony Winford. She is a licensed psychologist and a faculty in Knoxville, Tennessee. This is where she leads the on-site training for organizations, primary care clinics who are seeking to integrate their services. Shandy Gonzalez is a licensed professional counselor who works as a behavioral health consultant in a primary care clinic in San Antonio. Then Dr. Arissa, she is a licensed psychologist and a trained behavioral health consultant working towards transforming primary care clinics into integrated behavioral health. Then we have Dr. Chris Hunter. He is a licensed psychologist and a board certified in clinical health psychology. He recently retired as the Defense Health Agency's primary care behavioral health program director, where he led the development, implementation, dissemination, and quality improvement efforts for primary care behavioral health services in one of the largest health systems in the US, serving over 3.5 million individuals in over 300 primary care clinics. Then we have Dr. Brittany Houston. She is a licensed psychologist and an assistant professor at UT Austin Dell Medical School and a trained and practicing behavioral health consultant serving community clinics. Dr. Meredith is a licensed psychologist, and she's a director who oversees behavioral health integration in Texas A&M Family Care Clinic. Dr. Diane is recently a retired doctor of integrated behavioral health at Legacy Community Health. And finally, Dr. Becky, she is a senior lecturer and director of Masters in Social Work Integrated Behavioral Health Certification Program at Baylor University. And she provides her expertise in clinical realm, training, evaluating, and contributing to workforce development. So our faculties have worked really hard to develop this course. So I want to give you a quick background, a little information on what's covered in this 8-month-long course. So altogether, we have 5 modules that put together for this course. Module 1 will be an introduction on the role of BHC as well as the BHC core competencies. The idea behind this is that once you understand the competencies and the role of a BHC, it really sets a tone on how you work and function in primary care team. Module 2 is going to be working with not just primary care team, like your primary care provider, nurses, medical assistant, but also with other professionals like pharmacists, dietitians, community health care workers. And you will also learn how to effectively communicate with them and some of the strategies on how to do so. Module 3 will be covering some special topics in primary care. This module specifically targets those who may be working or may or may not specialize in OBGYN, geriatric, or pediatric clinic. Module 4 digs into the trenches of building health equity and addressing health disparities in the primary care clinic. And lastly, Module 5 is all about the technology in primary care. A lot of people were forced to move into telehealth when COVID happened, but now through this module, it'll take you back and show you how to utilize telehealth platforms for all kinds of relevant reasons. So if you're interested in applying for this course, the application will be due on November 1st, 2024. And the application does contain some multiple choice questions and some short answers, but it should not take more than 10-15 minutes to complete the application. The dates that are listed here are important since they are the dates for our trainings that require mandatory attendance. So please consider them carefully, whether you can attend on these dates. So the cohort will officially begin on February 25, 2025. This will be a 8 to 5 p.m. session. This is the boot camp launch of the course. Then we have the first live session in May, May 17, 2025. Then the PCBH refresher training, which will take place on August 21st, 2025. And then the second live session and the graduation event that will take place on September 27th, 2025. And all of the times and dates that are listed here are going to be on a central daytime. So our application layout, it includes demographic questions, your background, your work background information. There will be some discount related questions. It'll also include short answer questions, and there will be a training agreement document that you will need to also sign with it. So these are the important timeline for the application process. So the application deadline is November 1st, 2024. You will, if accepted, you will receive admission letter by December 2nd, 2024, and it'll include the cost of the course, syllabus with office hour and live events date and time. Student admission acceptance deadlines will be December 16. Enrollment will happen between January 1st and January 5, and then course payment will be due by November 12, 2 weeks before the launch of the date. So let's discuss some finances for this course. So the application fee for this course is $2,000. However, we do give everyone a chance to apply for the discounts as they are embedded in the main application. So there's no extra step for you. We want to make sure the process is as easy as possible. So as you go through the application questions, the discount questions will also be there. So you can just answer them as the rest of the questions and we'll take it from there. And the eligibility factor for discount are going to be based on the demographic, educational assistance, and your household income. We will also provide payment plan. First half must be submitted with the application, and the rest must be paid 2 weeks prior to the course start date. And expectations from the students. Please review these carefully. Expectation is that all students must attend and actively participate in all virtual live meetings, access modules, and complete the pre-post tests that we have put together for each of the modules, the toolkits, complete all survey and program evaluations, review all recorded lectures that are provided, utilize office hours that we provide twice a month, and also finally prepare for exam that happens towards the end of the course on the last day of the course on the second live session. And please note that if you're not able to attend the live session, you will be asked to withdraw from the course without any refund. And if you do not complete the surveys or the pre-post test or any assignments that are required for this course, we will not be able to provide you with CEUs and the BHCC certificate. So this is these are some of the testimonies that we've received from our previous students. So I'm just going to leave it there and see if there are any questions in the chat, and I'll answer any questions that you may have. Okay, I don't see any questions in the chat. Any questions so far?
Oh, I'm just going to speak out loud because I can't type that fast.
Sure.
I do have a question.
Yes.
So regarding the license requirement for eligibility, I do have a couple pre-licensed, BHC trainees on my staff. And, we provide supervision and sign off on notes and stuff. And they either are not licensed yet or have a provisional or temporary license. So I'm just curious a little bit about just the license eligibility requirement and if it has to be an independent license.
It has to be independent licensed, and they must also be operating in the primary care setting. So
yes.
Yeah, so if they have both, then they will definitely be eligible to apply.
Okay. So they're not eligible then until they've completed the 2 years postmasters and have the independent license. Is there, I'm curious if there's a reason for that.
Sure. So these reasons, these are all set up by our lead faculty, Dr. Obaid. So she sets up these requirements. And I think it just works better if we have these licensed professionals coming in all together and learning, because they already do have some of the background working as a behavioral health provider. So I think that was one of the biggest reason to put this as a requirement for the next cohort.
Okay, thank you.
Mhm. I have one question from Paul. You mentioned half the tuition would be due at the time of application. Yes, the payment will only need to be made in full if you are accepted. So yes, you will be refunded if you're not accepted. Kelly, you mentioned that there will be a module about the special population. Will the rest of the module be focused on treating adults? Yes, it'll definitely cover treating adults in primary care as well. Any other questions? Let's see. Would you recommend the certificate for BHCs who have already had a good amount of exposure to PCBH model? Yes, if they're already a licensed behavioral consultant and have PCB exposure in PCBH, but also remember other requirement is that they have to be working in the primary care settings. If they are also part of primary care team, then yes, I would recommend this course to them.
Okay, I'm just trying to decide if it's like additional things that maybe like myself or other members on our team have, that it would be additional education information, that we don't maybe already have, if that makes sense.
Sorry, repeat that one more time for me. I'm trying to understand.
I guess like some of the modules, it seems like potentially they could be a lot of information that like myself and some of our other behavioral health consultants have already been exposed to. Um, so I don't know if there's any insight you can give on details that are provided in some of those modules.
More insight, I can actually send that to you in an email. What I only know a nutshell of what each modules will be covering. These are all put together by our experts. So I don't know every little detail of the module, unfortunately, but I'm happy to send you that information via email.
That would be awesome. Do you need me to put my email in the chat?
Yeah, send it to me as a direct message.
Sounds good. Thanks so much.
Of course. Yes, I will actually follow up with you all after this call and send you a link to the application. So you will have access to the application after this. What do you see as the best candidate for this course? New BHC, seasoned. As long as they're licensed and working in the primary care setting, they all would be eligible. So I don't think it matters if they're new or seasoned, as long as they are licensed and are working in a primary care setting. Yes, Lana, I think most of those will definitely cover reviewing documentation and also address a traditional outpatient setting. Thank you for those private email messages. All right, there aren't any other questions. And we are good to go. Well, thank you all so much for joining us today. And I'll follow up with you all with some information and also the link to the application. Thank you all so much for joining.